In the last few decades, diet-related health issues, including obesity and related diseases like diabetes, have surged, presenting expensive long-term challenges to Minnesota's prosperity. Data show that unhealthy food consumption contributes to growing rates of obesity and diabetes that cost Minnesotans $2.8 billion annually. In addition, 20% of families with children face hunger or food insecurity that also costs Minnesota $1.6 billion annually in preventable direct and indirect health and education costs. There is growing consensus that Minnesota can no longer afford an obesity rate of 25%, a food insecurity rate of 11%, and the resulting economic and health impacts of that on our society. Because of that, a diverse group of individuals and organizations came together to develop the Minnesota Food Charter, a guide for policymakers and community leaders in providing Minnesotans with equal access to affordable, safe, and healthy food regardless of where they live or how much money they make. Access that not only improves health and well-being of residents, but also significantly improves the state's economy. We'll be discussing the Minnesota Food Charter on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we will be discussing the Minnesota Food Charter, an innovative effort spearheaded by the Minnesota Department of Health's Statewide Health Improvement Program, or SHIP, in partnership with the University of Minnesota's Healthy Food, Healthy Lives Institute, the University of Minnesota Extension, and the Center for Prevention at Blue Cross and Blue Shield of Minnesota. Let's begin this program by viewing this video about the Minnesota Food Charter.
The land, the people, the traditions, the food. For those of us who call Minnesota home, there are many reasons to love this state of ours, and one characteristic of our state is our ability to come together to solve problems. Yet a challenge that continues to confront us is access to safe, affordable, healthy food for all Minnesotans. Today, the cheapest foods are often the highest in calories and the least nutritious. For all Minnesotans, and even more so for Minnesota's low-income families, healthy food may not be affordable or even available, and many rural residents need to travel miles to purchase fruits, vegetables, and other healthy foods. The consequences of these challenges to healthy food access are real. This means many of us struggle in our day-to-day lives, at school, work, home, and in our community. Over time, a lack of access to affordable, safe, and healthy food leads to chronic diseases like diabetes, heart disease, and certain cancers. And while many farmers and food-related companies want to grow and prepare healthy foods, there are many barriers that need our attention. The truth is, our economy, where our food comes from, and how we get it, as well as our personal health, are all interconnected. Now we're proud to introduce the Minnesota Food Charter, a document that guides you in making healthy food available to more people. The Charter will offer healthy food policy and system solutions to improve access to healthy food in our schools, child care centers, workplaces, healthcare providers, hunger relief programs, communities, and stores. Anywhere food is produced, processed, distributed, and enjoyed.
Despite the fact that we have lots of agencies and lots of organizations working on food issues, we still have a lot of people who are not getting access to safe and healthy food. What the Food Charter does is take all of these efforts and synthesize them in a way that people can understand. It helps to get organized the efforts of all of these multiple agencies. This is going to make the efforts a lot more effective of everybody working in the nutrition and food distribution systems.
The Minnesota Food Charter is a result of hundreds of listening sessions, online town forums, as well as interviews with a diverse, very, very broad group of people, thousands of people across the state.
Food is such an incredible part of us, obviously, just ingesting it, but it's a part of our society. connected to our energy use, connected to our society, I think, in ways that sometimes we don't suspect or understand. And the food charter, I think, is a way, it's a way for me and for, I hope, all of us to look more critically and carefully at food and its interrelationship with our lives.
As a leader in government, local government, many times we're not even thinking about that there's a potential for us to improve the food systems, whether it's a transportation system or the pathways, walking pathways, bike pathways, all those things, if enhancing them and making sure people can get to the food sources.
Many of the reservations, they have similar transportation issues. The grocery stores are small, they're convenience stores, they have a lot of prepackaged processed foods. And while it's convenient, it's not always the best food for you. And that came out in the Minnesota Food Charter. So it looks at how do you impact that and make healthier choices in your community to increase access to better foods.
In North Minneapolis in particular, we have on one of our main corridors 37 unhealthy places to get food and one grocery store. So access is a huge issue. I believe wholeheartedly that if people had healthier options and increase in the number of healthy options, that they would make better choices.
Community members can begin to see that, oh, I've been trying to increase food access from purely a anti-poverty perspective. And then you'll begin to recognize that others are suggesting the same thing from a health perspective or from even a transportation perspective. And that we've been working in silos and we need to see the commonalities and leverage those common benefits.
I think it was really interesting with the food charter how all the different perspectives of people seeing a little piece of the food supply from their own perspective worked. And it's really a wonderful document because it brings all that input from all those perspectives together with a real understanding of the food supply.
The Minnesota Food Charter will help us leave a legacy of healthy food access for future generations and make Minnesota a more prosperous place for all. Explore the Minnesota Food Charter at mnfoodcharter.com. Find out what you can do and go make it happen. One person, one organization at a time, we can make a difference.
Joining me now to discuss the Food Charter is Vayong Moua, Senior Advocacy and Health Equity Principal at the Center for Prevention at Blue Cross and Blue Shield of Minnesota, and Kris Igo, Associate Director of the Healthy Foods, Healthy Lives Institute. Welcome to the program, both of you.
Good morning.
And I want to start with sort of a combined question. You know, one, to have you explain the organization you're from, but then why is the Food Charter important to the organization that you're representing and why it's important overall? So Kris, you know, tell us a little bit about the Healthy Foods, Healthy Lives Institute and why is the Food Charter important to what you're doing?
So the Institute originated under President Brunix as an initiative to increase and sustain the university's impact in the interdisciplinary arena of food, agriculture, and health. So we work to bring together agricultural and health scientists, basic and social scientists, and community and university partners, really looking at how to best improve the quality of the food that we produce with the output of improved community health. We are actively involved in the Food Charter. It's a natural extension of the work that we do. We have a lot of partners within the university that we work with, and it's an opportunity for us to look at research, evaluation, and programmatic opportunities to engage further with increasing access to healthy food.
Okay. Vayong, how does this relate to what you do at the Center for Prevention?
Right. Well, thank you for the question. First of all, many people may not even know what the Center for Prevention is, and just to remind folks that Blue Cross, Blue Shield, along with the state of Minnesota, sued the tobacco industry in the mid-90s, and it's with pride that I'll say that we're using those settlement dollars to channel back to the community and to work on chronic disease prevention, primarily tobacco control and obesity. And so we want to ensure that we approach obesity in a way that is on par with tobacco control, that we're changing policy systems and environments. I think we recognize that chronic disease is not occurring in a social vacuum, and we need to go upstream to attack the issue where it begins, and that's primarily outside of the four walls of a physician's office. And so we wanted to partner with the state, with the university, to make sure that we could take a health equity in all policies approach, and that we seeded health equity as a criteria in the decision-making process. And we know we can't do it alone, and so we need to work with health professionals, farmers, community health outreach workers, and multiple disciplines, multiple sectors, and that's what brings us to the table.
So why, I mean, there's a lot of people in Minnesota working on food issues in a whole variety of areas. Why is a food charter necessary? Kris?
Well, I would, taking it to the university level, we look at these complex issues as wicked problems. So we know that when we want to address and improve the health of our population, we know that in a food system, there are multiple sectors at play, right? We need to look at how that food's being grown, how it's being produced, how it's being distributed, what people are doing with it when they get it home, and then all of the social factors that contribute to the time that people have to spend preparing food at home, their ability to purchase that food, their ability to access that food in their neighborhoods. So when you look at all of these various factors, you know that you can't just tackle it with one approach. It requires a whole system of efforts, or 99 strategies in the case of the food charter, to really raise that bar for everybody in the state.
And so, Vayong, how do you bring all of these different factors and different organizations and different sectors together? How did you do that in the food charter?
Well, I think we were very intentional in making sure there's a health equity approach, and again, recognizing that so many of the issues that we're trying to tackle, obesity, economic development, again, no one sector can tackle that. And I think it's to enter this arena with humility and conviction that we need to do this collectively. And so I think all the partners at the outset saw that and recognized that we needed to work together. And so beginning with that principle, that's what prompted the partnership.
Well, it sounded, just looking from that video, you've got county commissioners and you've got food advocates and you've got farmers and you've got distributors. I mean, that must have been a unique organizing kind of an event. How did you, or multiple events, did people buy in pretty quickly to this idea of a food charter? Kris?
I would say that I think they did. We had 25 steering committee members, and in every case, people were flattered and thankful to be invited into the process, because I think everybody really recognized the value of a shared roadmap or a shared commitment across these multiple sectors. And I think when people are engaged in the work where they long for and look for additional partners to help improve the quality and outreach of the work that they're doing.
Yeah, so Vayong, does any other state have a food charter like this, or did we sort of create something different than anybody else has done?
I would say both. So there's been a few states that have created food charters. I know West Virginia, Michigan, Iowa, and Oregon. But I think Minnesota has uniquely approached the food charter from a multi-sector and a interdisciplinary and cross-cultural perspective. And this is not to, separate us from the other states, but I think we are also very intentional about putting equity at the center of all this work as well. I know that we were very extensive in our listening process. We had over 2,500 individuals and organizations offer input. We reached out to Hmong farmers, Latino immigrant workers, tribal leaders, different food companies, different healthcare providers. And so we were very deliberate in making sure that we were not prescribing a set of recommendations, but that we were listening and making sure that we are bringing forth the voices of what Minnesotans want in a healthy, equitable, and affordable food system.
Well, certainly from my perspective, where we have the Statewide Health Improvement Program, or SHIP, which really works on policy, system, environment change related to physical activity and nutrition and tobacco use, this fits right in with that. Do you see that, being built on that infrastructure that SHIP has throughout the state?
Yeah, I would add to the conversation about the other food charters, another unique quality to the Minnesota Food Charter is that it does have the health at the center of all of the work, and the partnership is a partnership between organizations like the Center for Prevention, Healthy Foods, Healthy Lives, and Extension, the Minnesota Department of Health. And that's unique nationally for the focus of food systems work to have the health proponents across the state supporting it and moving it forward.
Yeah.
Can you give some examples of how people can see themselves in this food charter? You know, be they corporate executives or single parents or teachers or farmers or garbage collectors. How can just some examples of how people can see themselves in this? Because it seems like it could be overwhelming.
Right.
Yeah. Well, I would invite you and our viewers to peruse the food charter, and you'll see that it takes a very comprehensive and visionary approach to a healthy food system. It tackles key areas around access, availability, affordability, the food infrastructure, and that's everything from farm to fork, as they say. And then we're also looking at food skills. And I would say, Commissioner, that in all these core areas, we're not just taking certainly an individual and educational approach, and that is the foundation. But we're really making sure that even food skills is applied systematically, that we're developing food skills in an institution, whether that's in schools or healthcare environment or childcare environment. And so it's not only the type of arenas, but it's the approach in which we're taking it.
All right, I want to delve in a little bit more specifically in some of those areas, but first we need to take a little break.
Sure.
So we'll be back right after this message.
Looks like it's done.
Don't let salmonella get funky with your chicken. On average, 1 in 6 Americans will get a foodborne illness this year. You can't see these microbes, but they might be there. So learn the right temperature to cook each type of meat. Keep your family safe at foodsafety.gov.
Welcome back. We're talking about Minnesota's food charter with Vayong Moua from the Center for Prevention at Blue Cross and Blue Shield of Minnesota and Kris Igo from the Healthy Foods, Healthy Lives Institute at the University of Minnesota. So where do you see this food charter going? I mean, we kicked it off about 6-8 months ago, something like that. What do you see changing, and what do you see what hopes do you see changing in the future as this food charter gets traction? Kris?
Well, I think broadly, it's an opportunity for state agencies in various sectors, from health to economic and community development to agriculture, to come together to collectively support increased access to healthy foods for all Minnesotans. I think people can see themselves in that space, and we're actively looking at how to support that going forward. From a funding perspective, we're a grant maker, as is the Center for Prevention. We're trying to bring together funders across the state to support these recommendations as well. And then just from a personal community member, parent perspective, I think it really creates a vision for a parent, for example, to walk into their school and say, I think we need a school garden, and what can we do to make that happen? Or I understand that more and more schools across the state are doing these farm to school programs, and what would it take for us to have that happen in our district? So it really gives a voice for parents and community members to go into the spaces where their kids go to school, their work environments, their churches or other community spaces, to say, what can we do together to improve our circumstances around healthy food.
So are there specific sections in here for individuals and for schools and for businesses that they say, oh yeah, here's a packet that I can use specifically? Yep.
There is, and we're creating leader guides for those that are in the decision-making capacity in those various spaces. But again, I think that you can have leaders that are prepared to do that work, but we need parents and community members and workers to come in and ask for those things.
Right. The food charter is very lofty and visionary, but please know that there are specific toolkits for different settings in healthcare, childcare settings, schools, and so we want to make sure that it's an inspirational document, but also very pragmatic, and that our that our fellow Minnesotans can actually operationalize this in their own sphere of influence and in their daily lives. And so we want to make sure that the visionary aspects can translate into daily operations.
So Vayong, what was sort of the infrastructure that brought this forward? Because other states have done, a few other states have done this, but not quite in the extensive way that we have. And Minnesota has really come forward with a unique approach, and it's actually, I just recently see some data where our obesity rates are starting to change. What's unique about Minnesota that's bringing this forward?
Sure, well, I see the convergence of a few different forces, if you will, in our landscape. Earlier you mentioned SHIP, and I think SHIP is a significant approach to prevention and chronic disease because it is reaching, again, outside of conventional public health, and it's going upstream to address health where it begins. And so with the statewide health improvement program, that really laid a key foundation in creating a menu of strategies to address healthy eating, active living, and tobacco control. And so that softened the environment up, if you will, for a partnership and effort like the Food Charter. I think if you look at the composition of state agencies who push this forward, the Department of Agriculture, Human Services, Health, Agriculture, and Education, I believe, that composition is not insignificant. Mm-hmm. It's rare that we see that kind of interagency collaboration to see the common benefits and common challenges, and to work beyond just symbolic leadership, but to have on-the-ground staff working together to advance health and equity. And so I think at the state level, we have a strong administration, we have a strong commissioner leadership, and then on the ground and in the community level, there's a groundswell of food and health advocates that are coming together in an unprecedented way. We now have anti-hunger advocates working with health advocates, working with researchers, working with farmers. And so the Food Charter, I think, expresses this mosaic of perspectives that was out there, but now it's brought together for a shared vision. Mm-hmm. And I think if you look closely at the Food Charter, you'll see some key values really stand out that express Minnesotan values, but also some very specific policies and systems change. I'll point out a key one, which I think is significant. Minneapolis passed the nation's first and strongest staples food ordinance. It lives within our Food Charter. It's supported there. And the Food Charter provides both, I would say, policy and community cover to do this type of work. And so for the first time, community advocates can cite the Food Charter, ally with other supporters who they never knew existed, or maybe avoided. And they may have been even enemies on past campaigns or past efforts, but now with the Food Charter, I think it provides, it's not just an expression of what was existing, but it can provide that organizing tool for community advocates, no matter what sector or discipline or culture they come from. It creates that open space for us to come together.
Kris, obviously there are some controversies in food. Not everybody's all, sweetness and light. How did you deal with some of the controversies that are there? We've got fast food, and we've got genetically modified organisms, and we've got pesticides, and we have all those issues. How were those dealt with in the Food Charter? Or did they say, we recognize that those exist, but there's so many other things that we agree on, let's work on the things that we can work on collaboratively?
Right. I think that from the very beginning, the strategic approach was access to healthy food. I think everyone can agree that that's a value in the state, that equitable access is and should be a goal for everybody. We are a food-producing state. It's hard not to get behind increased crops that are healthy and economically viable for farmers. So we have a growing, we are a grow farm state. So it was easy to bring those folks to the table. I think there's controversial ways to approach how to do the work when you think about taxing and other recommendations. We didn't get into that necessarily. We looked at how do we incentivize? How do we lower the costs of fruits and vegetables with market bucks, for example? Or how do we allow for better access to these things by changing the institutional environments where people spend their time? And so I think taking a vision that can be shared by everybody is the way to move this forward.
So how is this charter changing what happens at the University of Minnesota?
Well, again, it gives us a shared vision, not to keep using that language, but I think it's really valuable. It says that, there is interest and need in our agricultural sector to increase the viability of fruit and vegetable production in the state, because we know that that's what leads to better health for our citizens. It says there will be a market for this when it happens. It says that we need to create research and development tools, technical assistance for those new farmers. We are an ag college, we're a land grant, so we're responsive to the needs of the community.
Vayong, I'm going to give you the last word in our last 15 seconds. What are your hopes for the food charter? What do you want to happen after this?
I see, and I hope that the food charter can be this movement building tool. It's not going to magically just solve all of our problems, but I think if community members, advocates, policymakers can see themselves in there, can see their own agenda, their own interests, and use the food charter as an organizing opportunity, because it's my hope that we're not taking an issue advocacy approach, that we're just trying to tick off legislative priorities year by year, but that advocates are looking seriously about what's the right sequence of policies based on opportunity, community, momentum, and that we use it as a launch pad and not as just a playbook to check off.
So it's a long-term effort here.
Exactly.
Absolutely.
Chris, Vayong, thank you. This has been very informative. And
Thank you.
The food
Thanks
charter
for
is
having
a
us.
wonderful document. Thanks.
Right.
And I'll be back with a closing comment right after this message.
Don't let E. coli mosh with your food. An estimated 3,000 Americans die from a foodborne illness each year. You can't see these microbes, but they might be there. So always separate raw meat from vegetables. Keep your family safe at foodsafety.gov.
We all know that it's important to our health to have a healthy diet. But eating a healthy diet is not a simple task. Our food system is complex, and every step from growing of the food to its consumption and even dealing with leftovers has many complex and competing parts. And often our food system contains competing interests that often make healthy eating difficult. Yet, having access to safe, nutritious, and affordable food is a prerequisite for health. That's why the Minnesota Food Charter is so important. It shows policymakers, community leaders, and individuals how they can provide all Minnesotans with access to affordable, safe, and healthy food, regardless of where they live or regardless of their income. However, we know that the goals set out in the food charter can only happen by communities and partners from agriculture, business, transportation, government, and education coming together and working for the common good. This charter marries two areas where Minnesota has excelled and innovated: food and health. And I have no doubt that if any state in the nation can achieve the goal of a prosperous, economically vital food system that also promotes healthy, affordable food, it is Minnesota. We can help make the healthy choice the easy choice. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.